What if your body has been trying to warn you about diabetes and you didn't even realize it? Because long before most people are diagnosed, there are clear signs, but they're easy to miss. They don't feel serious at first, they don't seem connected, and most people are told they're normal or nothing to worry about. So they get ignored or dismissed or explained away until one day those small signs turn into something bigger. I've seen this pattern over and over again. People come in after they've been diagnosed, and when we start talking through their symptoms, they realize those signs were there months, sometimes years before. They just didn't know what they were looking at, and that's the problem. Because when you don't realize the early signals, you miss the opportunity to do something about it on an earlier stage. Hey, I'm Dr. Jason Schumard. I've spent the last 20 years working with people with type 2 diabetes, helping them understand what's really going on inside their body. And one of the most common things I hear is, I had no idea this was coming. But when we look back, the signs were usually there all along. Let's start with this. Diabetes doesn't just show up overnight. It develops over time, and your body often gives you signals early on if you know what to look for. Diabetes is a gradual process. Early warning signs are often subtle. Symptoms are easy to miss. Awareness is key. These early warning signs can be something simple as urinating more often, having more fatigue than usual. Maybe your brain isn't as sharp as it used to. You're not sleeping as well. You're waking up a little more often throughout the night. And initially, it may be easy to go back to sleep, but then it becomes more challenging to go back to sleep. These are all signs and symptoms that things are developing under the surface. And again, oftentimes people may say, I'm just getting older. It's just part of the process. But this is not part of the process. This is your body metabolically breaking down. You start gaining more weight. You don't feel good. You're starting to get more joint pain. Overall, your body feels like it's breaking down. This is not the aging process. This is not normal. This is a metabolic dysfunction that is driving and making you sicker. So let's go through the 5 warning signs that I see all the time, but most people don't connect to blood sugar issues. Number 1, constant fatigue. This isn't just feeling tired at the end of the day. This is feeling drained even after a full night of sleep. Because if your body isn't using glucose properly, your cells aren't getting the energy they need. Number 2, increased cravings, especially for sugar or carbs. When your blood sugar is unstable, your body keeps asking for quick energy, which creates a cycle of cravings. Number 3, frequent urination or increased thirst. This happens because your body is trying to get rid of excess sugar through urine, which pulls water with it. Number 4, your brain fog or difficulty concentrating. Your brain relies heavily on stable blood sugar. So when that's off, your focus and clarity can suffer. And number 5, stubborn weight gain, especially around the midsection. This is often tied to insulin resistance and how your body stores energy. If this is making sense, hit the subscribe button. I post videos every week that break this down in a way most doctors don't. Now here's what's important to understand. Most of these signs don't show up on standard lab tests right away. So people are experiencing these symptoms but being told everything is normal. So as these symptoms continue to mount inside your body and you're getting these lab tests done, nothing is being identified. You see, because things are developing in the system, and oftentimes these symptoms will be the first preliminary problems until enough damage has occurred that you start getting the bigger diagnoses on lab tests. You see, diabetes takes multiple years and decades to develop because enough of the cells have to become damaged before you start pulling more of that sugar into your bloodstream. So what happens? You miss this early detection, and this dysfunction continues to progress over time. And what happens is we start to normalize it. Oh, I'm just getting older. It's part of the process. Your doctors are telling you the same, so you start to believe this. This is not an aging issue. This is your body metabolically telling you there's a problem. If you know how to listen to your body and you know how to speak the language, you will understand something's going on and we need to identify what that is for you. At this point, you might be thinking, how do I know if these signs are actually related to my blood sugar? And this is where most people get stuck. They notice something feels off, but they don't know what to test or to look for. So I created a simple guide that walks you through the exact labs and markers we use to understand what's really going on. You can download it for free using the link below this video. My goal is simply to help you understand what's actually going on inside your body. You'll see which markers really matter and why normal labs don't always tell the full story. The earlier you recognize these warning signs, the more opportunity you have to change the direction. The earlier you understand what's going on and the earlier you identify what these problems are, the best case scenario. Because unfortunately, most people believe that, hey, I feel healthy, I must be fine. I'm still able to do my daily activities, I must be fine. They're waiting until the catastrophic event happens. The more focused you are on prevention rather than reaction, the better off you're going to be and the less chances of complications and you fully becoming diagnosed as a full diabetic. Because this isn't something that just appears overnight. It builds over time. And the sooner you understand what your body is telling you, the easier it is to address it. And that's how you move from being caught off guard to actually being in control. If this helped you understand your diabetes differently, download the guide below. Start there. And if you want more clear, practical explanations like this, make sure you're subscribed. I post videos like this every week.